We've all heard that daily COVID cases are falling nationwide. Now we're learning Americans are growing more optimistic about the fight against COVID. In a recent CBS News poll, 47% say things are going well, a gain of 11 points from just last month. Two major music festivals, Coachella and Stagecoach, just announced zero COVID restrictions. That means no mask mandates, proof of vaccination, or negative test for entry. To put it all in perspective for us, we are joined by Dr. Ashish Jha, Dean of Brown University School of Public Health. Good morning. How are you doing?
Good morning. I'm well. Thank you.
All right. So let's get right into it. Should we be dropping the COVID-19 related restrictions, mask mandates, proof of vaccinations? What do you think?
Yeah, so we're, first of all, in a way better place than we were even a month ago. The infections are down about 80% across the country. Deaths are starting to fall. This is a good time to look at all those restrictions and say, which ones do we really need? I think mask mandates can definitely get lifted. Vaccine mandates are going to be helpful for the long run, just keeping people vaccinated. So I think that's a good policy to have. But certainly mask mandates, restrictions on gatherings, I think they can start getting lifted.
Both the CDC director, Dr. Walensky, and President Biden both say we should not be lifting the mask mandates. Why do you think they are taking that stance?
Well, I think they're being careful. And look, we always want to be careful in these moments. So I appreciate what they're both saying. Infection numbers are still high. They're coming down, but still high. Deaths are still high. So I think what they're probably reacting to is let's wait a little bit longer. And I think I understand that. My take is things are so much better and heading in the right direction that over the next few weeks, I think it's perfectly reasonable to pull those things.
That's good news.
Yeah, that is. But, you know, a recent CBS News poll found that most parents believe that kids should be required to wear their masks in school. So how should schools be looking at this?
Yeah. So I'm a parent, and the way I look at it is if you're in a community with high vaccination rates, infection numbers are getting low, I think it's very reasonable to lift mask mandates in schools. It's lifting of the mandates, meaning if some parents still want to send their kids masks, if kids want to wear a mask, there's no downside to that. There's no restriction on that. But I don't know that we need to be mandating it at this point.
Yeah, you know, I was thinking at Sunday watching the Super Bowl that we may look back on that Super Bowl, which felt very normal. I didn't see a lot of masks in the stands and think that was a milestone in the country's turn away from the virus. But what's happening here, Dr. Jha, is a lot of people are still emotionally they're fearful, right? Yeah. They hear about removing these restrictions and their body says, whoa, 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 we remember how bad this was.
Yeah.
So what do you say to people who believe in the science, like you, think you're an authority, but are like, I'm just uncomfortable, something triggers me?
Yeah, no, I totally understand that. We've had 2 years of a very, very difficult pandemic. That's why I've argued for being thoughtful and slow about this. If people want to take their time, no one's saying if you want to continue wearing a mask for a little bit longer, I think that's completely reasonable to do. The question is, what restrictions should the government be putting on people? In that context, I think lifting those restrictions really does make sense.
And for immunocompromised, parents of immunocompromised kids, could those kids one-way mask? If all the other kids were no mask, they could have one on, that'd be okay?
Would it help?
Yeah, I think it would help a lot. So there's very good evidence that if you wear a high-quality mask, even if everybody around you is not wearing a mask, it protects you really well. So that's one way. Of course, we're getting treatments and other things for immunocompromised people. That'll help as well.
Break down for us what it means for these children now, where they've backed off from the Pfizer below 5 years old. Which parents do in that case?
Yeah, first of all, I know a lot of parents of kids under 5 were pretty disappointed by that decision by the FDA to just hold. I think it was the right decision. Look, at the end of the day, we want to be guided by evidence. And the evidence for vaccines 5 to 17-year-olds, terrific. The evidence just not quite in yet for under 5. So what I would say is good news, infections are coming down. Continue to be careful. Let's wait for the good data, the best data that we can get before we make a decision on kids.
We haven't won this fight against COVID, but it does seem like a small victory and a step in the right direction where we're at right now.
To even have the conversation.
Absolutely. We're in so much better place than where we were. And the good news is we're going to continue getting better. We're going to have more therapeutics, more vaccines. I think we're in good shape.
We got vaccines, we got treatments, we got immunity.
All right, and we got to go.
Yeah. All right. I mean, come on, let's have a moment. It's a good thing.
Okay,
All right.
we're having our moment. Dr. Jha, thank you so much.
Thank you.